Hello, good afternoon. My name is Asbil, one of the registrars. I thought it would be quite nice to just update myself and also the whole team about the cGRP in chronic migraine. cGRP is a calcitonin gene-related peptide that are now more and more common to use in chronic migraine. So calcitonin gene peptide was discovered in 1982 and has a link and been found to have a link with migraine from 1985. And cGRP molecules is released during the migraine by trigeminal activation. And infusions of cGRP can trigger a migraine attack. And from this, it's noted that cGRP has been targeted for acute and prevention treatment for migraine. And this is a picture of cGRP receptors and then the cGRP molecules. In the headache services within NHS Greater Glasgow and Clyde, we have 3 cGRP monoclonal antibodies for chronic migraine, which is irenemab, which is this anti-cGRP receptor antibody, so antibodies against the receptor itself. And then we have galcanezumab and framazumab, which is anti-cGRP antibodies towards the cGRP molecules. And to be considered for cGRP monoclonal antibodies for chronic migraine, they need to fulfill a couple of criteria. The first one is inadequate response or intolerance to at least 4 agents consisting of propranolol, amitriptyline, topiramate, candesartan, or Botox plus minus flunarizine. And of course, during the pandemics, Botox have its own challenges because it is very labor intensive every 3 months. It needs staff, consistently availability of staff to deliver the Botox. So towards the pandemic, Botox and getting less and less exposure or decisions towards Botox. So, but nonetheless, it needs to be an adequate response, at least 4 agents of listed on the screen. And adequate response is also defined as failure to achieve less than 30% reduction in headache days month and a 50% reductions in severity. And in this case, having a good migraine diary is absolutely crucial. So in terms of the 3 monoclonal antibodies that we have in NHS Greater Glasgow with Clyde, we have irenemab, or trade name Aimovig. The dose is 70 milligrams or 140 milligrams that's given monthly. The second one is galcanezumab, so Amgali, the trade name, is first given as a loading dose of 240 milligrams followed by 120 milligrams monthly. And the third one is framazumab, or trade name Ajovy, given either 225 milligrams monthly or 675 every 3 months. How to monitor the effect, and once patients decided to be or started on cGRP monoclonal antibodies for the chronic migraine, they will need to attend a monitoring appointment. There'll be 3 months review. The patient must complete the headache diary, and during the monitoring, we monitor for any side effects and especially blood pressure, because cGRP molecules itself is an active vasodilator. So blocking the cGRP using monoclonal antibodies this hypothetical risk of vasoconstriction and causing blood pressure. So it's important to monitor the blood pressure. Any positive response at 3 months review, the treatment will be continued for the next 9 months. If there's no effect of negative response, the patient will be re-reviewed again and consider for the next class of cGRP or the next options of cGRP monoclonal antibodies in 6 months with a 3 months break between the 2 separate agents. How to judge the efficacy of cGRP monoclonal antibodies? The positive response, again, the same criteria, more than 30% reduction in the headache days a month and more than 50% reduction in the severity. And the stopping criteria for cGRP includes a lack of positive response as above, had the patient become pregnant, breastfeeding, or reversions to episodic migraine at 1 year. What are side effects of cGRP monoclonal antibodies that we need to be aware of? Of course, because it's injectables, it needs to be reactions to the injection site, hypersensitivity because we're giving monoclonal antibodies, and antibody development, our own antibody development against the monoclonal antibodies. Specifically for irenemab, we need to screen for or ensure there's no hypertension in the background. There seems to be more cases of constipation reported for erinumab compared to the other cGRP monoclonal antibodies. And of course, for erinumab, we need to avoid in patients with latex allergy, because the cap for erinumab monoclonal antibodies injections is made from latex. That's my 135. Thank you.